breaking into regular programming for a WCIA 3 special report. Governor Pritzker is giving his daily COVID-19 update. We'll join him now.
Well, good afternoon, and thank you all for joining us today. With me this afternoon are IDPH Director Dr. Ngozi Ezike and Illinois National Guard Director, our Adjutant General, Brigadier General Richard R. Neely, as well as several industry leaders who I'll introduce to you in just a few moments. Illinois is a state with a grand history of profound impact on our nation. We invented the cell phone here, the first widely used internet browser, and the first skyscraper. Time and time again, the talented and forward-thinking people of Illinois who call this state home have stood up to meet the challenges of their time, and they've surpassed those challenges. Today, in the face of the unprecedented challenges presented by COVID-19, the people of Illinois have stepped up once again. Our innovative biotech companies and state-of-the-art manufacturers are teaming up with the state of Illinois to ramp up production of personal protective equipment, also known as PPE, through a newly launched alliance, the Essential Equipment Task Force. The Illinois Manufacturers Association, a statewide organization representing nearly 4,000 companies and facilities, will be coordinating manufacturers interested in donating or producing essential supplies that are FDA approved and sterilized. Things like N95 masks, gloves, gowns, ventilators, sanitizer, face masks, and more. Many of these companies are repurposing their facilities in order to meet critical demand. The Illinois Biotechnology Innovation Organization, also called iBio, represents 85,000 life science employees across the state. The organization has launched a COVID-19 response fund to make direct purchases of protective products at a competitive rate. Going forward, the Essential Equipment Task Force will work with the Illinois Emergency Management Agency to scale up to mass production of the FDA-approved PPE that Illinois healthcare workers need. I'm incredibly grateful to and proud of these Illinois organizations for stepping up to this moment. And we are lucky to have CEO and President of the IMA, the Illinois Manufacturers Association, Mark Denzler, and CEO and President of iBio, John Conrad, with us today to talk more about their collaborations and how their companies and organizations and other organizations can get involved. Mark and John will talk more about this later, but I want to emphasize to all of you, all of those in our audience today, that these factories will be adhering to strict social distancing guidelines to ensure that the workers behind the PPE are safe and healthy too. And I can't overstate how crucial this manufacturing capability will be in our fight against COVID-19. But we're not just waiting for in-state production. My administration continues to work day and night to scour the globe and the global supply chain. And today I can announce several new executed PPE contracts: 2.5 million N95 masks, 1 million disposable surgical masks, 11,000 gloves, and 10,000 single-use personal protection kits. I want to be very clear with all of you. Illinois' hospitals and nursing homes and first responders source and stock their own PPE. Additionally, due to the outsized nature of its need, the city of Chicago maintains a stockpile of its own PPE. Our state efforts are meant to supplement those and to support the institutions and municipalities across the state during this surge. I mentioned yesterday that we've had businesses and organizations from across the state contact us about donating additional PPE to support our response to COVID-19. These donations are counted separately from our existing supply. I would also like to make a direct ask to the owners of tattoo parlors and nail salons and elective surgery centers and other facilities temporarily closed during this crisis to contact my administration about their stores of PPE. If you or your business would like to help us protect our first responders by donating PPE, please contact us at ppe.donations@illinois.gov. That's ppe.donations@illinois.gov, and someone will reach back out to you to seek your donations. Since the beginning, I've promised you transparency and honesty on all aspects of our response. To that end, I want to take a moment now to run you through our PPE requests with the federal government and what we've received from them thus far. It's a long list of numbers, but I want to make sure that the public has all the information so that you can better understand where we're at and our efforts moving forward. The graphics next to me on my left also lay this information out and will continue to make this information available to you as we move forward. On March 6th, 3 days before we issued our disaster proclamation for the state, Illinois' version of a state of emergency, the state of Illinois proactively requested a shipment of personal protective equipment from the Strategic National Stockpile, the United States' largest reserve of pharmaceuticals and medical supplies housed under the Federal Department of Health and Human Services. The stated purpose of this supply is to support states as well as local governments during a, quote, public health emergency severe enough to cause local supplies to run out. We received our first, and until this week, our only shipment of supplies from the federal government on March 12th. It was only a fraction of our original request. We asked for 1.2 million N95 masks, 600,000 of which would go to the state, 600,000 for local governments, and we received 123,000 total. That's 10% of what we asked for. We also requested 900,000 surgical masks, and we received 45,000. We asked for 1.6 million gloves, 400,000 for the state and 1.2 million for local governments, and we received 163,000. We asked for 24,000 gowns, and we received a very welcome 45,000. We asked for 24,000 goggles, 4,000 for the state and 20,000 for local governments, and we received none. We asked for 120,000 face shields, and we received 56,000. We asked for 4,000 respirators, of which we received none. We also received 230 coveralls. My Department of Public Health directed a proportionate amount of these supplies to every hospital and local health department in the state that initially requested supplies, 150 hospitals and 62 health departments. Then focused the remainder of those supplies on the other areas of the state in most need. On March 20th, we made an additional request to the federal government for PPE for our public safety workers. We asked for 7 million gloves, 1.74 million N95 masks, 900,000 gowns, 43,500 goggles, 85,000 bottles of hand sanitizer, 43,000 canisters of disinfectant wipes, and 1 million meals ready to eat. If you were listening really closely, you might have noticed that that was a different list of items, both in quantity and type, than our March 6th list. In response, the federal government sent us the same size order that we received on March 12th, but no goggles, no hand sanitizer, no wipes, and no meals ready to eat. This latest shipment has a lot smaller percentage of gloves, N95 masks, and goggles than we requested. I want to be clear, thanks to the willingness of Illinois' manufacturers to support our state efforts, thanks to private and public donations, thanks to experienced public servants inside the federal agencies and the military, thanks to the incredible pursuit of this supply chain by our Illinois Emergency Management Agency, our Illinois Department of Public Health, and members of my own governor's office. Illinois is acquiring PPE to compensate for what we haven't received in our federal requests. But we are doing so while running up against obstacles that should not exist. I have medical professionals and first responders begging for things that they need to keep them safe. But so does Governor Cuomo in New York. So does Governor DeWine in Ohio. So does Governor Inslee in Washington State. We're all doing everything that we can to do our jobs, which is to protect our residents and to make sure our healthcare workers have what they need. We need the federal government to use the Defense Production Act to help the states get what we need. It's the federal government's job to make sure that a nurse being properly equipped in Illinois doesn't come at the cost of a doctor being ready for work in California. It's the federal government's job to make sure that we have a cohesive, prepared, robust national response. It's the federal government's job to make sure that cash-strapped states are not paying more than they should have to for supplies, that we are not watching prices go up by the hour because we're competing against one another, yet for the common good. I'm an Illinoisan, and I'm a governor of Illinois, and I'm going to do everything that I can to protect our residents and get us through this crisis. I said I'd fight like hell for you, and I'm doing that every minute of every hour of every day. One way or another, we need these supplies. And I have a whole team of people whose singular focus right now is working the phones across the world to get as much PPE as possible shipped to Illinois. They're the force behind the 2.5 million N95 masks, 1 million disposable surgical masks, 11,000 gloves, and 10,000 personal protection kits that I just announced. And again, I'm an Illinoisan, but I'm also an American. And so long as I know that there's action that the White House can take, things like aggressively wielding the Defense Production Act or actually buying and distributing the supplies that they say they're going to buy and distribute, I'll do everything in my power to make that clear on behalf of the people of this state and the more than 300 million Americans who don't call Illinois home, because that's the very baseline of what we all deserve. I want to close by once again thanking all of you for covering these press conferences so ably. I want to thank the citizens of Illinois who are stepping up to assist their neighbors and their families and their friends and their communities. And I want to thank the elected officials across this state in every city and town, Republicans and Democrats, who have been calling and emailing my office with leads on supplies and potential donations. You keep us going every day. Thank you very much. And now I'd like to introduce my Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Thank you, Governor. So today, we report that there are 236 new cases of coronavirus disease here in Illinois, which brings our total to 1,285. Sadly, we also have to announce 3 deaths, which brings the total number of lives lost to COVID-19 to 12. One additional county has been added to the rolls of counties that have seen a case, and that new county is Monroe. 31 of our 102 counties have seen cases of COVID-19. As the governor mentioned, there is a desperate need for personal protective equipment, or PPE, the gloves, the masks, the gowns that are needed to protect our first responders, our healthcare workers. Doctors, nurses, healthcare workers, including those who work in nursing homes and other long-term care facilities, they are on the front lines. We need to keep them healthy so that they can care for the most vulnerable among us, who potentially could suffer severe illness and, of course, even death. So we need to continue to do our individual and collective parts. To reduce the rate of spread, we need to reduce the exposures. And thus far, the people of Illinois have been doing just that. I thank each of you for all of your responsible actions. This has been done through what has been called social distancing, or more appropriately, physical distancing. When you're at the grocery store or you're getting gas, you can still be social and say hello. You can talk with those you see, but just maintain that distance of at least 6 feet. We know that simply exchanging a smile can be a positive interaction that still honors the distancing guideline. The virus is passed through droplets when you cough or when you sneeze. By keeping the 6 feet of distance between you, you decrease the risk of becoming infected. But of course, the best way to protect yourself, your family, your friends, your loved ones, is to stay home. Follow the stay-at-home order, and we can all help decrease the rate of spread and the number of people who become ill, and ultimately the number of lives that are lost. Thank you. And now I will give a summary of the comments for our Spanish-speaking population. Hoy estamos reportando 236 nuevos casos de COVID-19 aquí en Illinois. También estamos anunciando otros 3 muertes. El número de vidas perdidas a COVID-19 son 12 en Illinois. El nuevo condado es Monroe. Ahora el total de condados en Illinois con casos COVID-19 es 31. Como dijo el gobernador, hay una necesidad desesperada para equipo de protección personal, los guantes, máscaras y batas necesarios para proteger a nuestros trabajadores médicos. Los trabajadores médicos y enfermeras, especialmente los que trabajan en asilos de ancianos, están en primera línea. Necesitamos mantenerlos saludables para que puedan cuidar a la gente más vulnerable en Illinois. Pero también necesitamos continuar haciendo nuestras partes individuales y colectivas. Para reducir la transmisión, tenemos que reducir el número de personas con quien entran en contacto. Y hasta ahora estamos haciendo exactamente eso. Agradezco a cada uno de ustedes por sus acciones responsables. Esto se hace por la distancia social. Cuando estás en la tienda o poniendo gasolina en su automóvil, puedes saludar y hablar con los que ves. No más mantenga 6 pies entre ti. Sonriendo puede ser una interacción muy positiva que honra la distancia social. La mejor manera de protegerse su mismo, a sus familias y amigos es quedarse en casa. Sigue la orden, stay at home. Y todos podemos ayudar a los trabajadores médicos y gente enferma. Contigo lo haremos. Gracias. And with that, I will turn it over to Mark Densler, the President and CEO of the Illinois Manufacturers Association.
Good afternoon. Mark Densler, President and CEO of the Illinois Manufacturers Association. Thank you, Governor Pritzker, for your calm and steadfast leadership during this pandemic. I'd also like to thank the brave men and women who are on the front lines every single day, including women and men in manufacturing. Illinois is facing extraordinary times that rival some of the greatest challenges in our history. While the headlines are grim and the task is daunting, Illinois manufacturers once again stand ready to answer the call, conquer obstacles, and lead the way forward. The Illinois Manufacturers Association is proud to partner with John Conrad at iBio, an amazing leader and our partner, to quickly, efficiently produce this needed medicine, personal protection equipment, medical devices, food, and other products. Over the last few weeks, the Illinois Manufacturers Association has been inundated with offers from companies across Illinois. Some manufacturers are ramping up production of current products, while others are repurposing their facilities to meet the need. Liquor manufacturers are making sanitizer. Clothing manufacturers are making masks and gowns. Plastic injected molding companies are making parts for testing kits. This new essential equipment task force will help these companies collaborate, break down regulatory barriers in Washington, D.C. or Springfield, provide medical standards and testing, and help review the validity and safety of these products. Importantly, These products will remain in Illinois to help our families and our neighbors. We have a website where you can go to help, www.ima-net.org, and click on the dedicated COVID-19 page. There is a site, www.ima-net.org, and click on the COVID-19 page where if you're a supplier, you want to get involved with this, you can. Governor, once again, the IMA and Illinois manufacturers are proud to answer the call. We're going to stand with you, and we're going to get this done. Thank you. And now it's my pleasure to introduce our partner, John Conrad from iBio.
Good afternoon. My name is John Conrad. I'm President and CEO of the Illinois Biotechnology Innovation Organization, also known as iBio. I want to thank Governor Pritzker for his leadership during this pandemic. iBio is the association that represents the 85,000 life science employees in Illinois who work in the biopharma, medical device, and food and nutrition industries. Our life sciences community is leading the charge in the fight in Illinois against COVID-19. Illinois' innovative companies are ramping up efforts to study the coronavirus and develop solutions to prevent, diagnose, and treat this deadly infectious disease. As a community, we are proud to support Governor Pritzker's efforts to provide immediate support to the healthcare workers and first responders by partnering with Mark Denzler and the Illinois Manufacturers Association to launch the Essential Equipment Task Force. We are directing our members to make donations of unused personal protective and medical equipment to the task force, which will provide immediate support to the frontline healthcare workers in Illinois. And we're leveraging our corporate leadership to work with the Illinois Manufacturers Association to assist Illinois manufacturers with technical capacities to begin short-term production of essential medical supplies. We are also excited to announce that iBio's public charity, the iBio Institute, is launching a COVID-19 response fund to coordinate corporate, private, and philanthropic donations to make direct purchases of protective medical products to support Illinois-based healthcare workers and first responders by leveraging our industry's relationship with major distributors. As a community, we are coming together to help protect our healthcare workers and our first responders to combat COVID-19 in Illinois. For more information on our programs, you can visit www.ibio.org. Thank you, and I'd like to welcome the governor back up to the podium to answer questions.
Thank you, John. Just a brief comment that I'm really proud of the companies represented by both iBio and the Illinois Manufacturers Association for stepping up in this way. It's so critically important for the future of the health and safety of the people of our state. I also want to just say about General Neely, who's standing to my left here, that he's done just an outstanding job being of assistance to our healthcare professionals, helping us stand up drive-through testing, making sure that we're staffed appropriately where we need to be. His soldiers, his troops have just been tremendous. I mean, we often see them fighting floods for us across the state and doing other important things, but it's rare that we get to see them in action in what I would describe as professional capacities, truly helping the people of our state through this pandemic. So with that being said, happy to answer any questions you may have.
Thank you. This is ordered. How soon will it get here, and how much does it all cost?
All right, the governor is now taking questions after briefing media and the state on the COVID-19 outbreak in Illinois. We will continue to bring you updates on air and online at WCIA.com. We will be on air for WCIA 3 News at 5. We'll now bring you back to your regularly scheduled program.